start. Today, topic of the webinar is how to deal with the unexpected. So we will be having two great presentations. Let's start with the first one. So here is our first speaker, Francesca De Donato, and she will provide the information on how can a national healthcare system prepare, respond, and recover from the extreme heat and heat waves. We will give her a floor in a second, but before I will also have a pleasure to introduce the second presentations, of which the speakers are Michaela Kovářová and Jiří Dolníček. Excuse me for my pronunciation, I do my best. And in this presentation, we will hear how the Fire and Rescue Service of South-Moravian region in Czech Republic prepares for weather-related events that can happen suddenly and fall outside of what we have already prepared as a PSAP everyday responsibilities. So here we will have a Q&A session at the end. Before giving the floor to Francesca, let's run through some practicalities. The first important thing to know is how to ask question. Well, we have this Q&A window in which we invite the participants to submit their questions. The speakers can. Maybe they will not be able to, or we will not have time to respond to all the questions, but as mentioned before, the Q&A we will have at the end after the two presentations. What if you will have some connection problems? Here, as a moderator, I mean, we cannot really help you much, but I invite you to either reconnect and connect again if you have audio issues, or to go to the Zoom support webpage, which gives a lot of information on what can be done when, if you cannot connect, or if you have troubles watching the webinar. What I've already mentioned, the webinar is recorded. We will post all the materials of the webinar by this Wednesday afternoon. And you will also be able to find the recording of this webinar on EENA's YouTube channel. This was a very short introduction. I don't take any more time because the presentations are very interesting, and I would already invite the first speaker, Francesca, to share her screen. And, perfect.
Great. So good afternoon, everyone. My name is Francesca De Donato. I work at the Department of Epidemiology of the Lazio Regional Health Service. And on behalf of the Ministry of Health, we manage the Italian Heat Health Prevention Plan and Warning Systems, which I'm briefly going to describe today and give you some results from this last summer's heat waves in 2021, which, as you know, in Europe has been an exceptionally warm summer. Hold on a minute, because I can't really see top of my screen. Okay, so as we know from the latest IPCC report on impacts, adaptation and vulnerability, which came out in March 2022, the impacts of climate change induced by human activities have caused widespread adverse impacts, both in terms of to the natural environment as well as to people beyond natural climate variability. In all regions, the report has shown us how extreme heat events have resulted in human mortality and morbidity across different areas of the globe. And although there has been some progress in terms of adaptation and planning and what has been implemented, we still see that there are some gaps and there's heterogeneous progress in terms of what is being done. So we still need to do a lot of activities, not only to reduce emissions and so mitigate climate change that are going to occur, but also in terms of adaptation and improving their response to these extreme events. In response to this, the WHO a couple of years ago published a framework of guidance to build climate resilience health systems. So if we really focus down on what climate change and adaptation and response could be in terms of health services, this document really looked at different aspects of climate change and what the impacts can be in terms of emergency preparedness and management, financing, climate resilience and sustainability improving vulnerability, capacity and adaptation assessments, as well as integrated risk monitoring and early warning systems. And if you think of heat adaptation plans, these sort of encompass several of these aspects, but are only one of the focal targets. If we're talking of heat, obviously we know that climate change has an umbrella of different exposures, of different health risks associated to the different environmental exposures, if it's extreme precipitations, storms, droughts, etc. As we're going to see in the later presentations as well. Here we're going to be focusing on heat waves. Additional to this, after the 2003 heat wave event that interested most of Europe and had an impact on health, the WHO in different countries started to develop heat health adaptation plans and action plans to respond to these extreme heat wave events that occur. And the WHO identified a series of core elements which should be central to what a heat adaptation plan should have. So starting from the identification of a lead body and who should coordinate all the actions, the introduction of accurate and timely site-specific warning systems, not based solely on the exposure, so identifying extreme temperatures, but also considering the impacts on health, providing specific information campaigns, not only to the general public to raise awareness, but also in terms of who are the groups most at risk within a population, and also information for caregivers and response services within the healthcare system, but also in social services and care, in order to better respond and reduce the impacts. What was necessary again was a preparedness of the health and social care systems and how, let's say, emergency plans are adapted for these extreme heat weather events, for example, which is something typically not done in a healthcare system. The identification of vulnerable subgroups, as I said, it's not only sufficient to provide information of who they are, but what was needed was a formal identification of who they are in each specific location and address specific measures towards these subgroups. If you think of the elderly who are living alone, for example, or people with specific chronic conditions associated to heat, which we know are most at risk. It was also important to have appropriate real-time surveillance. So what are the impacts that we're seeing in terms of health? What was lacking in 2003 was that by the time we realized what the impact on health in terms of increase in emergency room visits or hospital admissions or ambulance calls, it was already too late and we couldn't respond in an adequate way. So if we know in a timely way how things are changing or what is going on, we can adjust response and planning of measures to heat waves as well. And then in more long-term adaptation, we can think of reduction of indoor heat exposure, both within the healthcare system, for example, in hospitals, conditioning, for example, throughout. So how is the Italian heat health adaptation plan actually structured? Well, it was introduced after the 2003 heat waves. As I said, it was managed both by civil protection, who in Italy is the main body in charge of emergencies and dealing with extreme conditions and emergency situations, but also from the Ministry of Health perspective, in that it provides guidance to the different regional healthcare services on how to introduce an adaptation plan. It is structured around heat warning systems for the different cities included, and these are the biggest cities at regional level, either regional capitals or cities with over 250,000 inhabitants across Italy, as you can see in the map. This graded warning system is based on the heat, not only on heat and defining weather conditions which are extremely at risk, but also the impact on health in the different locations. And a different series of actions are put in place based on the graded level of warning. In terms of health surveillance, we have a rapid mortality surveillance system, which is active in 34 cities and now has been extended to 50 cities. We have a rapid emergency room visit surveillance system as well. And then we evaluate what has happened throughout the summer and provide information to the different healthcare services, but also post hoc evaluation at the end of summer to see where we need to improve things. In terms of prevention, the Ministry of Health defines some guidance and guidelines on what the system should actually include. So the different cities, regions could implement one themselves. We formally identify susceptible subgroups and follow them up throughout the summer with an active surveillance plan carried out by different users, as I will show you later. And then we develop specific advice for susceptible subgroups, training for healthcare professionals, and we carry out a survey of the local plans and actions that are put in place, and this is all available on the Ministry of Health website as indicated here. Sorry, I'm having some issues with sending this forward. Okay, in terms of governance of how it's managed in Italy, it's coordinated, as I mentioned before, at national level by the Ministry of Health. We manage the heat warning system, we provide the guidance, and this information is then accepted or modulated within the different regions, because in Italy the health service is managed at regional level, so there's an autonomy by the different regions on what they do and how they manage their health services, and then they adopt their own system, and it has an information network which is introduced. They define their vulnerable subgroups and how to actively monitor them throughout the summer. They can set up a helpline, and they have an actual plan that is put in place. This is then adopted at local level in the cities which are included in the heat plan, because in Italy, as I mentioned before, it is city heat plans. It's not extended to all the regions, although some regions have also done this. And these modulate all the actions that are included in terms of emergency services, definition of emergency protocols, and the dissemination of the information related to the heat plan throughout the summer. This is just to give you an idea of the heat prevention network in Italy and who it's managed by. So as you can see, it's a series of different stakeholders. It involves civil protection, who usually have the information and disseminate it locally. Healthcare services, obviously, who are involved, as well as social care services in terms of response to vulnerable subgroups. And then some are also modulated by local warning systems other than the national one. In terms of heat health warning systems, what are we talking about in terms of weather forecasts? So what we did was develop city-specific models based on the temperature-mortality relationship. As we know from the literature, when we go to extreme temperatures, we have an increase in the daily risk of mortality associated to exposure to high temperatures. And based on these two models that we developed, we can then forecast at-risk conditions for the following days. This is how our warning bulletins work. There are 3-day warnings, so we have a 3-day forecast in which we issue a 4-level graded warning. Level 1 is a pre-alert system, so people know that something is going to change in the following days, temperatures are rising, for example, and they should start planning the emergency situation. Level 2 and level 3 is when we issue a warning and a heat wave is approaching, and level 3 is just 3 consecutive days of at-risk conditions in terms of very high temperatures, which are associated to a risk in mortality for local populations throughout the cities. How is the information then distributed in the network? As you can see, we manage the warning plan. We disseminate the information nationally to the Ministry of Health, which publishes everything on its website. And we have a national group of stakeholders. Then at local level, we disseminate it to a reference person who is then in charge of disseminating it locally to all the different stakeholders, which can be hospitals, retirement homes, social services, private registered users, GPs, and whoever is involved. And this again is disseminated also throughout different websites. As you can see here, I've just provided a couple of examples. Nationally, we provide it to the Ministry of Health. We publish it for the Lazio region, which is where we are, and we operate in the healthcare service on our website, and then it's distributed to the municipality of Rome and within the different health services and local health authorities, sorry. So as you can see here, as Roma 1, which is the one of the ones in Rome. In terms of prevention, this is the national guidance we provide. So for specific subgroups, there's information on why some people might be more at risk than others. For example, for the elderly, what they should do when a heat wave occurs. And if it's social or healthcare services, which are dealing with people with specific chronic conditions or the elderly or children, again, what they should be doing and what the symptoms that might occur could be. Obviously, these are updated with upcoming evidence. We provided information, for example, for COVID-19, because again, the people more at risk from having severe conditions during COVID in the last 2 years are also the ones that are most at risk during heat waves. So it's an added exposure and risk factor as well. So it was important to distinguish if you're having a heat stroke or you're exposed to heat, or if you have COVID symptoms, or if you have COVID and you're exposed to heat, what can the risks again be? So that was information that was relevant to include and update. In terms of health prevention measures and what is specifically done, let's say in terms of preparedness, it's important to have a specific written prevention plan in order for all the stakeholders involved to know what they should be doing, when they should be doing them. Education campaigns and educational programs are set in place throughout the different regions in Italy. Emergency protocols are specifically defined for hospital settings, nursing homes, social centers, etc., in terms of what to do when a heat wave occurs. So when they receive the warning bulletin and there's a level 3 issued, for example, for a heat wave in place, what should they be doing? What should be changed? Should they change where, I don't know, the most susceptible people reside, move them to the cooling spaces, things like that, change their medical and pharmaceutical treatments, etc. Registers and susceptible subjects, again, these are surveyed in the different regions. In Italy, it works a lot with GPs, who are the first point of contact with health services, and so they can survey those most at risk. Telephone helplines are set up both from the Ministry of Health, which has a national helpline, as well as regional and municipality ones, which also have dedicated health operators who can respond to the risks associated to heat and guide callers to what they should be doing, as well as health surveillance, as I mentioned before. In terms of what we do at regional level, to give it a bit more context, what we have been doing in the Lazio region, for example, where we have, as I said before, an active surveillance of patients over 65 with specific chronic conditions associated to heat. GPs survey these patients through a telemedicine service. So they contact them directly, they check up on their health status, and they might refer them to a hospital or just change their pharmaceutical treatment, or then check up on them after 2 days when a warning is issued. What we saw in the different years, we saw that there was a moderate response from all GPs or from healthcare services. So we wanted to increase awareness at the population level in terms of the health risks, which is always relevant and important. But on the other hand, improve the adherence to the heat adaptation plan through societal resilience, which is something we're doing in a European project called Engage, which is engaging society for risk awareness and resilience. More specifically, as you can see here, we have a surveillance platform where a GP is registered, has a list of all his patients, and they check up on him. He has a way of including all the information on the health status of a patient. We have a triage clinical parameter as well, and we monitor the severity of health conditions. This telemedicine service was set up in response to COVID over 2 years ago, and then it was adopted to the heat adaptation plan. So again, it's a way of showing how we can use similar services or services already in place for other things that can also be used for climate change risks and extreme events. And so making the best of the services already in place at regional and national level. In terms of surveillance, as I said before, it's really important to see what is going on in a timely fashion. It's no use saying, oh, there was an increase of mortality related to a heat wave 1 or 2 years after, when the data is already, let's say, old, and we know the impacts are there. We need to respond in a very timely fashion in order to reduce the impacts. So this rapid mortality surveillance system, which now includes over 50 cities in Italy, as you can see here, really provides up-to-date information with 1 week delay or 3-day delay on the actual numbers of deaths in each city. So we know what is happening during a heat wave, and we can adjust the different response measures in each city. For example, through this service, okay, as you can see here, these are just examples of how we show our data. We not only use it for heat waves, as you can see on the left. I'm sorry, it's in Italian, but the website is in Italian. And on the right-hand side, you see the same data was also used to survey the impacts of COVID in the last 2 years. It provided very rapid information on the increase in mortality in the different cities around Italy in response to the COVID pandemic, or in response to vaccination, how numbers were declining in terms of that as well. Briefly, I'm just going to show you some results, some specific results related to last summer, to summer 2021. As we know, it was very warm. Data from ECMWF and Copernicus from the Climate Data Service data store showed how temperatures were much higher across most of Southern Europe in summer 2021, especially between July and August. In Italy, temperatures in August were on average 3 to 4 degrees above average, especially in the south of Italy, as we will see in more detail. This is just a summary of the number of warnings that we issue each summer during between 2010 and 2021. And as you can see, there's some sort of heterogeneity in the years. So some years are very hot, like 2015, 2012, 2019. But again, even 2021 in the south of Italy, for example, in yellow, you can see it was the highest number of warnings that we issued, with over 80 warnings in just 3 months in the different cities. If we look at this in more detail, looking at the different cities included in our heat adaptation plan, you can see that between June, July and August, we had 3 main heat wave events, one in the second half of June, which interested mostly the center and the south of Italy, and another one in July, again, that interested the central regions and mostly in the south, but the most extreme event was recorded in August, between the 9th and the 16th of August, in which we had several days of level 3 warnings throughout most of Italy, but again, extreme temperatures of over 45 degrees were recorded mostly in the south of Italy, in regions like Puglia, Sicilia, and Calabria. So what does this mean in terms of the impacts on health? We can see here the weekly mortality during summer in the cities grouped together by those in the north and in the center south. And as you can see from what we saw from the data, we didn't see much of an effect in the first heat waves, but when we moved to August, we saw an increase in the mortality. As you can see, the black line is above the dotted line, even if it's within the confidence band interval. In the south of Italy, we see a higher impact of the extreme temperatures, with average values of weekly mortality rising above the average. If we narrow this down and look at specific cities, here I've just reported 3 examples. We see cities of Milan in the north of Italy. The orange bar shows the heat wave episode. In the black, you can see how daily mortality increases in response to the increase in temperatures in the red line above it. And for the month of August, we see an excess in mortality of 11%. Similarly, for regions in the south, for cities like Catania and Palermo, we see that during the different heat wave events, especially during August, there is a dramatic increase in daily mortality above the dotted line, which is the average that we see in that typical period. Again, here we see an excess in deaths of mortality comprised between 40 and 55% in the 2 cities. So quite a dramatic increase for those 2 heat wave episodes we had in August last summer. That was just a very descriptive analysis. If we look at this in a more, let's say, epidemiological perspective, and we actually model the temperature mortality association in the cities in north and central southern Italy, we can see how the impact of the temperatures we observed in the last summer, so 2021 with the blue lines, compared to a reference period shown in the red line, so 2010 to 2018. And we can see that while in the north of Italy, there wasn't much of a change in the relationship between exposure to temperatures and the risk of mortality. In the south of Italy, we see an even more high risk of mortality when we're exposed to high temperatures. The curve basically shows that if you look at it, until temperatures reach around 35 degrees, here we're talking about maximum apparent temperature, so an indicator that combines both temperatures and humidity. We don't really see a change in the risk of mortality. The more extreme temperatures we reach, then we see an increase in that curve, so it goes upwards, and we see a positive risk in mortality, so an increase in the daily deaths associated to exposure to those really high temperatures, which we've seen in the last 2 years. Obviously, we, as I said before, we carry out these evaluations. All the data is provided on the Ministry of Health website, and they are made available to all the different cities. And overall, they're also included in the National Institute of Environmental Protection Agency, ISPRA for Italy, in which they provide annual data on the environment. There's also a section on health at the end, which also summarizes our results. And then we also carry out scientific publications looking at the impacts, for example, of cold spells, of heat waves, but also of how this relationship varies over time in response to the adaptation measures introduced, which is what we're interested in here, showing how public health measures can help reduce or contrast the impact of extreme temperatures in Italy. And considering climate change in the coming years, obviously the impacts will be higher, and so we really need to be prepared to respond to a greater issue over the coming years. Thank you for your attention, and that's it from me. Here is my email if you have any further questions that we can't address today, and 2 links where you can find all the information that I've just shown. Thank you very much.
Thank you very much for this detailed presentation and so much information provided. I think we can move immediately to our next presentation. So I would invite now Michaela and Giri to activate their presentation.
Okay, thank you. Hello, everyone. I'm going to talk about the phenomena that affected a part of the Czech Republic last year. For many of us, it was something unexpected, and nothing like this has ever happened in our country in the last 600 years. It was something extreme, not only for us as firefighters, rescue and medical workers, and all those involved in rescue and recovery works, but especially for the people who were most affected by this incident, whether in health, life, or their property. By this phenomena, I mean the tornado that struck the southern part of the Czech Republic on the 24th of June at around 7 p.m. The intensity of the tornado reached the F4 level, which is a wind speed up to 320 kilometers per hour. Although the tornado lasted about 30 minutes, firefighters remained in the affected area for 28 days to help with the most important needs of the residents. Now you will see what the situation was like in the first moments after the tornado struck, how everyone helped, and what the area and countryside looked like afterwards.
Kumáška 240 lomeno 302 růž, 320 růžice u Hodonina, že tahakem nám prasky plyn a balítová a ještě elektřina. K279 Lužice, prosím vás, tady nám uniká plyn od silnice a sousedovi tam hodí auto, já mám strašně obavy, že se něco stane. V Břeclaví spadlo elektrické vedení, víte o tom něco? Nevím. Nevíte, nejde ani mobilní síť, ani z mobilní data nefungují nic a jsme tady uvězněni na dálnici. Dobrý den, prosím vás, okamžitě hasičů, Lužice, Velkomoravská 260 spadlý barák, hoří, jsou tam 2 malé děti a maminka. Pedem 100. Bude nás paní předchozí, tiše. Potřebuji se okamžitě záchrannou službu. Lužice 177. U Ružáku, směr Ružák. Těhotná žena, upadá mi do bezvědomí, pokročilé stádium. Okamžitě se potřebuji záchrannou službu. 521 na Těžkovice, jsme 50 metrů před zatáčku na Pánov, je tady spadlé stavení, uvnitř je malá holčička, vykročujeme ju, je tady zraněný člověk, po autonehodě, potřebovali jsme tady zdravotní záchrannou službu, přijet. Prosím tě, jednotka žena více zneužít se nechodou mezi Ratíškovicama a Hodoninem. Teď vyprostujeme 2 malé děti. Budeme resuscitovat, 1 osoba je výstup, potřebujeme pomoc. Pedem 100. Fakt tady potřebujeme potřebuju tu záchrannou službu. Opravdu, udělejte s tím něco. To se nám přijde. Já jsem tady zvolal. Situace aktuálně taková, že je to na úrovni apokalypsy doslova do písmene. Vyhlásit zvláštní stupeň okamžitě na moji odpovědnost. Okamžitě zaktivovat minimálně 5 operačních jednotek, aktivovat veškeré, co máme k dispozici a připravovat na transport sem tady na to místo. Jedna zraněná osoba medika odvážená policii na nějaké místo střediště. Mám to na to vedoučované se zemí. Zdravím. Ano, žeravíte. Vyvodíme další osobu. Jak to vypadá s tou záchrannou službou? Já rozumím, ale my máme těžce zraněná osoba, jedno dítě stále resuscitujeme, jedno dítě jsme poslali osobákem do špitálu do Hodonína. Aktuálně není sila územního odboru ani dobrovolných jednotek poskytnout tyto informace a vyčíslit zranění minimálně v desítkách, ne-li ve stovkách. Jsou tady rozletané naprosto nové čtvrti domů, které se tady postavili před rokama. Stovka baráků nemá střechu, části srovnané úplně se zemí. Nejsme schopni poskytnout informace o zraněných. Přijem.
Haló! Je tu někdo? Haló!
As you've just seen, the situation was very serious, but the weather forecast did not indicate that such an extreme phenomenon could occur. The warning was only level 2 out of 3. You can see the orange color on the map. The system of the emergency services was not prepared in advance to the highest possible capacity. The fact that tornadoes do not occur in our country at all, therefore, there is no reliable system for forecasting this phenomenon. Even 20 minutes after the tornado struck, this information was not available on the main public television news. The destructive path of the tornado, which struck the territory of 7 municipalities, was between 100 and 700 meters wide and 27 kilometers long. The affected landscape is flat with a high proportion of agricultural land and especially vineyards. The destructive force of the tornado was enormous, so logically the entire infrastructure that runs above the surface was damaged. It is typical for this phenomenon to cause extreme damage in a short period of time. Shortly after the tornado struck, normal life in the area completely stopped. Dozens and hundreds of people were transported to hospitals on their own. People were left on their own in the first minutes, and they helped each other. The aid was random, without a systematic structure. The overall result of fatalities and injuries seemed good as time went on, because higher number of dead and injured people were expected. I have to mention that our PSAP is served by officers of Fire Rescue Service. It is divided into two sections, answering emergency calls and dispatching firefighters to the incidents. According to the meteorologists, the tornado hit our republic at 7 p.m. The first emergency call was received 9 minutes later, and it started an avalanche of other calls. The increase in emergency calls was expected after the experience of previous storms. However, requests for help started to increase due to people being trapped and severely injured. There was a very terrifying accident involving a bus that flew several meters in the air and went over a railway embankment. We haven't experienced anything like this in previous disasters. It was more than an hour later when one of the commanders reported that it was the tornado. The crisis management team of the Fire Rescue Service was activated during the answering a large number of emergency calls. Its members arrived at PSAP to get the latest and detailed information about the situation. They decided to divide the affected area into several sectors and sent a command officer to each sector. Shortly before 9 p.m., one of the commanders reported from the scene and described the situation as the apocalypse, with the expectation of a large number of injuries and fatalities. During the evening, we discussed the way of rescue operations with the responsible persons from the General Directorate of the Fire Rescue Service. We made some pre-plans to call in special forces and resources from other units and organizations. It was necessary to arrange additional forces and resources for the affected area, but at the same time, we needed to arrange them for another area as well, because strong winds and rain caused damage and flooded houses in the remaining part of the South-Moravian region. We also actively called local authorities and gave them the contacts of the commander who was located in their municipalities. The crisis management team decided to use a unique frequency for each sector due to the overloaded radio network with reports from the rescuing firefighters. The subsequent information from the fire units that were in the affected area gave the assumption that a large number of heavy equipment and manpower would be required to clear debris and fallen trees from the roads and built-up areas. Therefore, we requested the deployment of the forces and resources of the Army of the Czech Republic. The cooperation with non-governmental organization was requested in the first hours, especially as a rear support for the fire units. And then these organizations focused on providing humanitarian aid to the disaster-affected persons. In view of the extent of the damage, the governor of the South-Moravian region convened the crisis management of the region, where he was provided with the latest information. The Director General of Fire Rescue Service of the Czech Republic arrived at our PSAP, and he was informed about the response to these emergencies. After the meeting of the crisis management of the South-Moravian region, the governor declared a state of emergency in the affected area so that decisions and further steps could be taken more quickly to deal with the consequences of the tornado. This is especially because of financial support and easier participation of the private sector. And there is no need for tenders and other administrative steps. At that time, I considered the actions of our shift manager to be essential in managing the situation at our PSAP, because he distributed the activities very well among the officers and also decided to call all available officers to duty. Because the number of emergency calls quickly reached beyond the capacity of our PSAP, the shift manager set up a system to handle incident on a priority basis. During the evening, it was clear that the consequences would be dealt with in a matter of days, and therefore a system for officers was prepared for 3 days in advance. Due to the large number of collapsed buildings, expert assistance was requested from structural engineers from all over the Czech Republic. It was important to get a general overview of the situation in the affected area on the second day after dawn. Drones and unmanned aerial vehicles were used to take photographs for this purpose, and it gave the incident commander a better view of the situation. The enormous extent of the damage was clear from these images. Therefore, the headquarters of the Fire Rescue Service of the South-Moravian region requested to dispatch special fire units from all regions of the Czech Republic, including a rescue unit with special equipment for debris removal. A great wave of solidarity arose throughout the country, and large numbers of volunteers began to arrive into the area. And it was necessary to arrange accommodation for them. And the first option offered was a sleeper train, which was transported to one of the villages by a private owner at his own expense. Now you can read the most important activities we did. I would like to mention that the first fire units on the scene were under enormous psychological pressure. They faced the situation they had never experienced before, unable to get to where they were dispatched because of debris and blocked roads. A huge logistical problem had to be solved after the rescue work was completed, and that was how to get as many workers and equipment as possible to the affected area, and at the same time, removing debris as quickly as possible. In addition to these activities, intensive psychological assistance was provided to the affected population. There is a statistic from the field concerning the firefighters and also the Army of the Czech Republic, which in this case was directly under the command of fire incident commander. The material damage was immense, and even less than a year after the tornado, it is still very visible in all of the affected villages. I would like to point out that the costs of crisis management during the firefighters' deployment was estimated at around 2 million euros, for example, for building materials, trucks, and heavy equipment, catering for all firefighters and volunteers. The tornado caused a huge number of very serious incidents in a short time. This put an extreme stress on the officers at our PSAP. If you look at the first 3 negatives listed on this slide, you can imagine that we soon lost the necessary overview of the incidents. Emergency calls from other PSAPs were forwarded to us unnecessarily. Instead of making the situation easier for us, the other PSAPs put us under more time pressure. By analyzing the incident, we came to the opinion that if we had more dispatching workstations available, it would certainly increase the efficiency of our work. The ambulance service center was similarly overloaded, and therefore we communicated with each other only on a very limited basis. At the moment, we had the At the moment, we had the situation at our PSAP under control. Volunteer firefighters arrived at the affected area without being dispatched by us. And this had a very negative impact on the management of the incident in the affected area. A large number of officers responded to the request to come on duty at PSAP. They arrived very quickly and were actively involved in dealing with the incidents. The radio network remained functional, unlike the network of mobile operators. Frequency distribution helped solve the initial total overload of radio channels. Each affected village was given a different frequency. The police reacted very quickly to the announced arrival of a large number of emergency services, and they closed the part of the highway leading to the affected area, but it happened after the declaration of a state of emergency. The highway was therefore open only to emergency services. It was very effective to use our so-called mobile operation center directly on the scene. This is a vehicle equipped as our PSAP. It is used by 2 officers. It includes satellite data link, and we usually use it when dealing with longer term incidents. The direct contact with the incident commander is the biggest advantage of it. Well, how to prepare for the unexpected? This is not easy to answer. In dealing with the tornado, we learned what we did well and where we still have some reserves. Regular training is the absolute basis for the education of PSAP staff. In practice, this means that a certain amount of time is dedicated to mutual learning or self-study during each shift. The professional level is guaranteed by the shift manager. Since 2013, we have implemented a new element. It is the mobile operation center, which I mentioned earlier. And it allows us to be flexible and get in touch directly with the scene of an incident. The base of the vehicle was purchased by European Union funding for the fire rescue service. Although we regularly participate in exercises of the integrated rescue system, this method of training cannot really create an actual overload of the system at PSAP. And we believe that with the help of virtual reality, this can be achieved. In cooperation with our headquarters, we want to prepare some model cases that will test the ability of individuals and the whole system to deal with similar incidents. Not all officers were able to be involved in the first phase of the incident. That's why we prepared a comprehensive analysis of the entire incident in the form of a presentation in order to share the experience with the others. This is a part of our preparation. In the context of crisis management, it was not expected that a tornado of such devastating force could hit the Czech Republic. And this leads us to rework the overall risk analysis of the territory of our republic. And this is a task for our colleagues in the crisis management department. Their outputs should be used as a basis for the preparation of training cases using virtual reality. We consider our efforts quite positive as time passes and the experience raises our professional self-confidence that we are able to cope with previously unexpected situations. That's all for me. Thank you for the opportunity to share our experience with you. And if you have any further questions, please write to this email address.
Wow, thank you. Thank you. It was difficult to watch, of course. However, the mobilization of your forces, the organization of actions that had to be taken, the reinforces that you managed to pull up together, yeah, it's quite an achievement. So bravo. Really, I take the moment now to thank all the volunteers, all the rescue, fire services, emergency service, other. It's just, yeah, in this kind of situations, we are humans and we show this solidarity to help. That's the first thing to do. So yeah, thank you. Now, the question and answer session. We have 1 or 2 questions. We will not try to prolong the 1 hour of webinar because, well, it's as you've seen, the speakers been sharing their emails. If you wish to ask them more questions, feel free. A small notification to participants, please write your questions in the Q&A chat. So I have a first question. Let's go back to the first presentation, Francesca. You have a question about your health plan. So how often do you assess, review, and change your health plan? Is it something that you do regularly, or if you notice differences, observations, how does it work? If you could explain it more, please go ahead.
Yes, thank you for the question. So our plans are updated, well, they're revised, well, they're evaluated every year, and they're revised accordingly based on the evaluation and what can be done, both in terms of if we notice that there are any issues, if there is additional funding or evidence that we can do something more based on what is available. That is done regularly. Maybe not annually would be a bit too much, I think, but yeah, it's done on a regular basis. The evaluation of the impacts and the evaluation of all the different services involved, all the different actions that are carried out, the services that are put in place, both from health services, emergency services, and social services are collected each year. And these are revised within the different organizations, both regionally, locally, and then all the information is provided back to the Ministry of Health. So it's a regular task that we carry out.
Okay, and I point out again that the presentation of Francesca will be available as of tomorrow, Wednesday, sorry, on the webpage. So if you feel like going and grabbing the details of the health plan, please feel free to do so. It's there for you. Now, a quick question to the second presenters. Do you have a public warning system in place? If not, do you consider implementing it since it can be helpful in this kind of situations? Would you like to take the question?
Yes, of course. We unfired the warning and alert system has been built in the Czech Republic since 1991. The system consists of network of alarm sirens, which provide immediate warning of the population, and as well as system of notification centers, a system of remote notification, transport of signals and information between the notification centers, and a system of local alert system. So Czech Republic, the Fire and Rescue Service of the Czech Republic is also entitled to enter the media to inform the population via television and radio networks. So the population may be subsequently informed by the media, television, radio, by taking sirens by vehicles on the integrated rescue system, or any other way about that has happened, what to do in such a case.
Thank you. Some questions coming, maybe? No? Well, we still have time for one more question. And this one is again directed to you, Jiri and Michaela. How did you manage the overflow of emergency calls? Did COVID-19 had an impact on the increase in calls as well?
Yes, of course. I think that in the first half of March, when first cases of COVID-19 were recorded in the Czech Republic, the 112 emergency line noticed the increased number of calls, of course, also due to extensive media campaign. After the state of emergency was declared on 12th of March 2020, the number of calls almost doubled compared to the average. So we were about 3,000 calls during the first weekend of the state of the emergency, and there were frequent call overflows to the different other regions. So therefore, we invited the offer of the Faculty of Medicine of Masaryk University here in Brno in the first days, and the students were participating in the fight against COVID-19 disease. They strengthened an in-line responding questions of no acute nature concerning COVID disease. During the period, the total of, I don't know, 300 calls were forwarded into the information call line.
Thank you. Thank you very much for responding to the question. I don't see any more questions coming, so I will very quickly sum up the webinar and remind participants about when and how to find the recording. So the presentations of today and the recording will be available by Wednesday afternoon this week. You will be able to find it on our webinar webpage and the recording on YouTube channel. If you have any questions or suggestions, feel free to share them with us. You have our email address there. And for more webinars information and updates, please go to our webinars page as well. We don't have yet more webinars to announce to come because we are very busy finalizing the organization of our conference that is going to take place end of April in Marseille in France. So just the final words to thank the speakers of today for sharing their job, what have been done in two different scenarios to fight the uncontrolled weather hazards, because indeed we have different perspectives, but one thing that is sure is that we are mobilizing our forces and we are sharing definitely the knowledge between each other, and that's why this webinar is for. So you can ask still the speakers if you have more questions. They shared their contact details, so thank you very much. Bye-bye.
Bye.